Recently, I was talking to a new grad that I precepted, and I told her that you have to be willing to speak up. She was telling me that she got handoff from another nurse who had floated to the unit, and he had left the patient saturated in stool and urine. The drips were almost running dry. There were a number of problems that she found when she got report from this nurse. And she had told me this had happened 2 days in a row. And I expressed to her, well, did you speak up and say something to that person? And she said, no. And then I asked her, well, did you do bedside handoff? And she said, no. And bedside handoff at our hospital is considered doing report, going in, laying eyes on the patient, doing a 2 RN skin check, turning the patient, looking at their sacrum, boosting them up in bed, doing a position change. So to that, I told her, well, honestly, you can't really blame them. Although it is wrong that they left that patient like that, and you would never leave your patient like that, you did not go in and co-sign on the patient. So by doing bedside handoff and letting them be free to go, you are accepting the patient in their current state and condition, and you're saying, I'm okay with this. I co-sign on what you're leaving me. Even if that's not true, by accepting bedside handoff the way that you did, you are saying, I'm cool with this. So the key takeaway here is when you're doing bedside handoff report, definitely go in, lay eyes on the patient, do a position change so that your patient's not getting a DTI. Make sure your patient's not filthy. If they are soiled, this is a great time that you have help. You don't have to wait on a PCA. Be like, hey, we're gonna clean this patient. If the drips are running dry, this is time to say, hey, can you grab me another bag of Levo? Can you grab me another bag of fentanyl? Do it while you have help around, because who knows what staffing is gonna look like for the day. Who knows if the one PCA that's on the floor is gonna have to sit on a 1-to-1. Always, 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 always do bedside handoff report and lay eyes on the patient with the off-going nurse.